upward rotation or downward rotation. So remember when we were doing the palpation, we were learning to find the bony landmarks. And part of what I was showing some of you was how to find the scapula. Okay. One of the things I'll do is just glide your hand up that rib until that inferior angle sits right in your thumb. Okay. Once you do that, then you have your client move. So forward flexion or abduction has to include some upward rotation. If it doesn't, it's not going to happen. Okay? So that's one of the things. So it's not a movement that this part is not what you're going to measure necessarily. You're going to measure glenohumeral flexion, abduction. But if you're stuck here, it may be because these scapular muscles are not working and something's not allowing the scapula to rotate properly. Okay? Because what has to happen is as this comes up, okay, so if you look at this, as this comes up to a certain point, you're going to bump into the acromion. Unless that rotates to get the acromion out of the way for you. Okay? All right? So, if we're looking at just a straight scapula, elevation, depression, protraction, retraction, upward rotation, downward rotation. Trick treat. I turned into a 2-year-old this time now. Okay, these are pictures right from your book. Okay, so this shows you, so the darker red one is the actual scapula, and then this ghosty one is where it came from. So where it came from to where it's going to. Okay? This picture shows protraction, retraction as a little bit of abduction, adduction, and it's kind of all built in together. Okay? Okay, so here's a picture, and again, this is from your book, so here's that inferior angle tilting up. So this is what it looks like on actual pictures. I guess you're going to have the video too, right? Okay. Scapulothoracic articulation. So we've talked about this before. It's not a joint. The scapula moves over the rib cage of the thorax, so it's not directly attached. Okay? So this puppy is just gliding over the rib cage, but it needs to sit pretty flat on that rib cage in order for it to move properly. So if it's in a position where it's tipped up a little bit, or winged as we call it, that indicates some muscle weakness that's not pulling it down flat against the rib cage. So that, you know, because if I'm winged like this, can I really rotate properly? Yeah. So it's connected indirectly via the clavicle and several muscles. And so muscle strength is key to keeping that scapula flat on the back of your rib cage. So, you know, keeping that scapula flat against the rib cage also, it helps to provide motion like I was just showing you, but it also adds to the stability of the shoulder. Okay, so it's just like we lay our patients down to get that thorax stable to measure. Okay, this lays this down here to give it a wider base of support to work from, to support your shoulder, because this is not really tight in real tight, is it?